I would like to call as chairperson Senior Consultant Andrology and Urology from Apollo Hospital, New Delhi, Dr. Ajit Saxena, sir. Sir, please. As we move further, our next topic covers one of the most common problems of aging and a very big cause for hospitalizations in the elderly. The talk is based upon urinary tract issues in the aging population. Our next speaker is the Director of Urology from BLK Super Speciality Max Hospital. With his enriched experience and excellent knowledge, he will deliver on the scientific concepts of keeping the urinary tract healthy in the aged population. Dr. Rana, please, the stage is yours.
बुरा जो देखन मैं चला, बुरा ना मिले कोई, जो दिल खोजा अपना, मुझसे बुरा ना कोई. You perhaps be surprised about this, but I tell you, in recurrent UTI, we are the culprits. The doctors are the culprits. A lot of myths, a lot of wrong treatment, a lot of things which are not understood. And the moment a patient comes to you, you start prescribing antibiotics. That is not the solution for recurrent UTIs. It's lifestyle changing that's most important. But we have Dr. Rana, a young and dynamic urologist.
Thank you, sir.
And let's hear what he's got to say about recurrent UTI and the aging male.
Thank you, sir. Thank you very much. And at the outset, I would like to thank you, Dr. VP Bansal, sir, and the organizing committee for giving me this opportunity. So I'll be talking about strategies for prevention and management of urological issues in aging population. Just to give you a message about the demographics, India, now in 2020, we are the youngest generation, and in 2050, we'll be heading towards the more elderly population in India. So it's always better to be aware of the preventive tips and the better disease prevention, and that will help us for having the better life in the elderly ages. So there are 4 steps of the healthy aging. Is like first the preventive checkups, the screenings and the vaccinations. As far as urology is concerned, practice safe sex and the hygienic practices. Then exercises, move more, and eat well and drink well. So why this all is different in the aging population is because the management of urological issues in elderly is quite difficult in terms of their change in the mobility, dexterity, sleep patterns, altered mentation, hypertension, stroke, diabetes, and drug tolerance. So I'll be covering the common urological issues with old age. I'll be discussing about the lower urinary tract symptoms, prostate, benign and the malignant both, the urinary problems like incontinence, overactive bladders, urinary tract infections, and briefly I'll touch upon the erectile dysfunction and the sexual dysfunction. So all of these problems, they affect quality of life very significantly. There are some physiological changes which happens with the aging. As the bladder ages, there are lots of overactivity in the bladder due to instability. Prostatic enlargement happens with the age. Tendency to excrete more water during night. There is atherosclerosis of the vessels, which leads to impotence and ED. There is accumulation of cellular damage which happens over a long period of time. Hence, the cancer incidence also increases as the aging, and the hormonal alterations like atrophic vaginitis and recurrent UTI. So briefly touching upon the natural history of the prostate, there is an estimate of about 6 ml increase in the prostate size per decade, and not all the prostate produce the symptoms. The BPH is most common, and the most common symptoms are like weak stream, hesitancy in passing urine, frequent urination, urgency, and sometimes the sense of incomplete voiding. Then the treatment options for the BPH, if it is mild symptoms, there is just the watchful waiting and the timed voiding. You need not to do anything, no medical management for the BPH when there are mild symptoms. For the moderate symptoms, there are very various safe medicines and
Electrical dysfunction.
yes sir. So we're giving PD5 inhibitor. नहीं, मेरा तो ठीक है बेटा, ये तो लग जाएगा, उसमें लग रहा है, हमेशा चलता है। ये हिल रहा है इसके हाथ में। तो एक काम करो, इस नीचे वाले को हटाओ यहाँ से। इसको अब लगाओ।
चेंज करने पे ही हो रहा है, अगर बैक चेंज करने पे ही हो रहा है।
चलो अब मैनेज करते हैं, क्या करें।
कोई कॉपी होगी इसकी फाइल तो मैं इसमें डाल के चलाता हूँ।
इसमें वीडियोज हैं एक्चुअली थोड़े से, लेट्स सी कैसे होता है।
2 सेकंड के लिए क्योंकि वरना फिर ही हिलता होगा।
थोड़ा सा होता है बीच में।
अगर पेन ड्राइव में मेरे को प्रोवाइड कर देते, ये है यहाँ पे, यहाँ से पेन ड्राइव लग जाएगी।
टाइम वेस्ट होगा।
While this is being sorted out, do you know why women in the aging group, they have recurrent UTIs?
इसमें भी नहीं आ
One of the main causes of that
इसमें डालोगे?
is that lifelong they have been holding their urine. You go to a public place, you don't find toilets, and that disrupts the very good balance between bladder neck and the bladder, which results in UTI. You do what you might, but unless you correct that dysfunction, the urinary tract UTIs will keep coming and going on.
पेन ड्राइव आ गया ना?
Similarly, in the males, it is generally bladder outflow obstruction as age goes by. And unless you treat the outflow obstruction, their recurrent UTIs will not be cured.
नहीं, इसमें लगा देंगे।
वीडियोज हैं एक्चुअली।
I think it's going to take some time.
इस वजह से हो रहा होगा।
Would anybody like to share their UTI experiences? Yeah, please, ma'am.
Honeymoon cystitis is very common.
Yeah.
In pregnancy, because of the tract, you have the first trimester only we should be doing complete urine as much for asymptomatic bacteria.
इसको मिनिमाइज करके वीडियोस भी डाल दीजिए। इसमें है 1 GB की वीडियो भी।
UTI is very common, and I think most of the people they do suffer from UTI, so it should be taken care of.
Sure.
People should be made taking off lot of water every day, maybe 10 to 15 glasses of water, cranberry juices. Those people who are not diabetic can have that. That is a natural way of treating. Lot of water should be taken. Maybe when you get up in the morning, lot of water should be taken for the
You've brought up a very important point. Yes, sir.
Right. Being an orthopedic surgeon, I would like to draw the attention to a patient who has to be put on catheter long term, especially traumatic paraplegia
Right.
patients. You should try and remove the catheter as early as possible. Even if the catheter has to be there, it should be tied and released intermittently, so that recurrent UTI does not take place. So this could be one. Another, geriatric patients, hypotonic bladder. So these are situations
Yeah.
where recurrent UTI again very
You've brought out a very important point
right.
that diabetes can be a problem.
Right.
And in fact, diabetes causes multiple ways of action. One is uncontrolled diabetes. That will give rise to infections because of the lowered immunity. Then the medicine is given for diabetes. Now this is very interesting. People go to the doctor with a urine routine examination and it shows glucose 2 plus. And before anything you say, wow, patient's got marked diabetes. But that's not the case in all the scenarios. There's a group of drugs known as glitazones, dapagliflozin, which acts by throwing out glucose from the body and getting in the urine. So what will happen? You will get 2 plus in the urine. And unless you are aware of the fact that it can be due to the medicines, you will put him on all sorts of tests and give him something. So these days it's most important, if you get glucose positive in the urine, to look at the medicines that the patient is receiving.
Yes.
And 9 times out of 10 you'll find that dapagliflozin is the cause of all this. The third way it acts, as Sir pointed out right now, is hypotonic bladder. In diabetes, the bladder becomes hypotonic, and then it doesn't throw out as much urine as it should. There's some residual urine, and this residual urine causes infection. So in diabetes, they're very important causes, and once you get recurrent UTI or even UTI, it is imperative that diabetes is ruled out, especially in India, where we have so commonly. Specialized cases where it occurs is in chemotherapy. Patients have reduced immunology, and these special groups require further attention. They should have regular urine culture. Incidentally, UTI, urinary tract infection. People do a urine routine examination, 20 to 30 pus cells, oh, he's got infection, or she's got infection. That is not correct. For UTI, the culture should be positive. If the culture is not positive, look for other causes of similar symptoms. And only if the culture is positive are antibiotics required. Otherwise, therapy to reduce the local edema, to reduce the local inflammation, and to increase the outflow tract, these are the things that are required in a normal so-called UTI.
And for post-operative early catheter removal, we should encourage doing CISC.
Yes.
So clean intermittent catheterization is very helpful technique. So once after that 4 or 5 days of immediate catheterization, when the patient is just ambulant but not able to pass urine fully, so teach the family member CISC. Very simple technique. Give the self-voiding trials, make the toilet comfortable and the bedside commode. All these small things can help for prevention of UTI. Right. And regarding, ma'am, your question of honeymoon cystitis and taking the proper treatment of that thing is also very important, because we have seen that this small infection leading to long-term recurrent UTIs and later on pyelonephritis and all this thing. So these young females, so sometimes the problem remains that they are not able to empty out the bladder fully. So the high PVR, what we usually see in our OPDs like ultrasound with the PVR assessment is a very important thing. So, and the shy bladder is not very uncommon in females because of the not available, having the toilets, the sanitary toilets in the school. They used to go washroom in the morning, then they hold urine till the evening, and late afternoon, evening they pass urine. So the bladder is overstressed. Over the period of time, this is the one factor for recurrent UTI.
Dr. Rana, why don't you come here and we'll have a discussion?
So, yes, sir, we are, as it is taking time, so we can take the questions first.
Yeah,
Then
we can discuss it.
yes, please, sir. Thank you.
Point I wanted to get, the hygiene when the children are very young, especially for the females. In schools and colleges, maybe the hygiene is not good, the availability of water is not good, and maybe washing from front to back is not taught at all.
Yes.
So I think the school and hygiene is very important. The commodes in the trains, no touch technique, maybe yoga position may be a better thing for...
No, I beg to differ. This commodes in public places, the toilets in public places, they may be dirty, but do not transmit infection.
But you see the seats in the train, only I was traveling, it was awfully dirty. You know, so I think something
Hygienically
should be
it's not
done even
correct.
for those things.
But infection doesn't come like that.
But could be one factor for when
Yeah.
they, yes.
Just one
they
factor where
touch
they are unhealthy.
other things like that. Great, sir. Sorry for all this delay, but we had a nice discussion in between. So I'll just briefly go through the, yes. So what we'll be discussing today will be lower urinary tract symptoms due to BPH or the malignancy, carcinoma prostate, and some brief touch on others malignancy also, as the cancers are more in the elderly person. The incontinence and overactive bladder, UTI, and erectile dysfunction. All these symptoms, they affect the quality of life very significantly. Little bit about the physiology of the aging. As the bladder age, bladder develops detusser instability, and there is tendency to excrete more water during night, which leads to more frequency during night also. There is atherosclerosis of the vessels, which leads to impotence and erectile dysfunction. Accumulation of cellular damage over long period of time, that is the one precursor for the cancer incidences in higher incidence in elderly, and the hormonal alterations leading to atrophic vaginitis, and one of the important cause for recurrent UTI in elderly female. So as the person ages, the prostate size also grows. It's almost around 6 ml per decade of life. The symptoms are frequent urination, hesitancy, weak stream, and retention of urine, leading to a feeling of incomplete voiding. There are very simple treatment choices for prostate management. When the symptoms are mild, just the watchful waiting and the timed voiding. And this will take care of most of the symptoms. When the symptoms are moderate, medicines are there for helping the proper urination, and simple procedure like urolift can help. When the symptoms are severe, prostate is very big, the high PVR residual urine is very high, and other complications like when there is stone, hydronephrosis, then we should not delay the surgery by the TURP, bipolar TURPs, laser procedures, sometimes robotic simple prostatectomy, and like this. So in this era, the prostate should not lead to any renal impairment. There should be no UTI, recurrent UTI, because there are good treatment options available. Briefly about the medicines, there are two classes of medicines, alpha blockers and 5-alpha reductase inhibitors. One is for immediate symptomatic relief, other is for decreasing the size of prostate also. Quite safe, and we can use them for long period of time as well. For the treatment option, the laser prostate surgeries like HOLEP or the bipolar TUR enucleation or TURP surgery, and the Urolift system. All these three options are quite safe, and patient get very good symptomatic relief. Cancer also increases as the age advances. So the carcinoma prostate, it is curable if detected early and appropriately managed. We have to stage-wise give the treatment option for the patient. In the early stage, the curative intent is the aim of treatment. The robotic prostate surgery, it is quite safe, and in the majority of patients, when the disease is localized, we give them a cure of up to the tune of 100%. So in the prostate surgery, what we are doing is like removing the prostate out of the body and joining the bladder and the urethra. It is a safe surgery nowadays. It takes around 4 hours with the reasonable continence and reasonable erectile functions. The beauty is like most of our patients, they go back to the wards and they are discharged on 3 or 4 days only. Something about the bladder cancer. Here the prevention matters most. The smoking is one of the major risk factor for the bladder cancer. Other risk factors are exposure to unsafe chemicals in the workplace and the hair dye also. That's the reason that I stopped dyeing my hair. Drink plenty of fluids and stick to a healthy diet plan. Check ultrasound, do urine routine examination, and screening is the most important thing for the bladder cancer. Do cystoscopy if required, and once there is some small tumor, we have to do the resection of this tumor and do some surveillance cystoscopy and some medicines. So bladder cancer can also be cured and can also be treated for a long period of time. Sometime when it's a muscle invasive disease, then we do a radical cystectomy with the help of robot. The radical cystectomies are also not very, very difficult surgeries. And there used to be one time when the big surgeon means the big incisions, but now the bigger the surgeon, there are no incisions. So the radical cystectomy and the new bladder was created for this patient, and this patient had a very good follow-up, and he's almost 7 or 8 years. He was around 75 years gentleman who had a radical cystectomy with the new bladder formation. So everything was done intracorporeal dissection, and all the anastomosis were done robotically, and like this the intestine was anastomosed, and that's how the new bladder looks like. About the kidney cancer, the risk factor remains the same, smoking, and here the CKD is also a risk factor for the kidney cancer. So the blood pressure control, your diabetes control, maintain a healthy weight, and avoid harmful chemical. Exercise will also help for your overall health and the kidney cancer. As you can see in this image, like there are multifocal disease, multiple tumors. So both sides, the robotic partial nephrectomy was done. So partial nephrectomy is a very good technique for curing the kidney cancers, because we have to preserve as much nephron as possible. This, with the help of robot nowadays, the majority of tumors, they can be excised by saving the major part of the kidney. So for that patient, we did bilateral robotic assisted partial nephrectomies. So something about urinary incontinence. Incontinence sometimes is a transient phenomena. It could be because of just small infection. UTI can lead it to the atrophic vaginitis, some restricted mobility. Some incontinence could happen because of the post-operative period, because in elderly they have polypharmacy medicines, and some medicines also increases diuresis, and there is transient incontinence. So we have to classify incontinence in terms of the stress incontinence, overflow incontinence, or the urge incontinence. Thereafter, we have to treat as per the diagnosis. So its stress incontinence is most common in females because of genital prolapse and atrophic vaginitis. Post-menopause changes also leads to sometimes stress incontinence. So timely Kegels exercises and the timed voiding helps for controlling majority of the symptoms of stress incontinence. Urge incontinence is because of detrusor instability, sometimes Parkinsonism, and the stroke also leads to these kind of symptoms, and UTI also causes urge incontinence. So we have to treat the underlying factors, then only we can take care of the urge incontinence. So there was a national overactive bladder evaluation study. So as the age advances, the overactive symptoms in the male because of prostate, in the female because of atrophic vaginitis and other symptoms, and bladder overactivity increases. There are a couple of medicines which are very safe, can be used for overactive symptoms, like oxybutynin, solifenacin, darifenacin, like that. So medicines with the behavioral modification and the exercises gives good outcome for the patients. So summary for the incontinence treatment is like we have to treat underlying factors, estrogen supplementation for atrophic vaginitis, anti-muscarinic agents for overactive bladders, and pelvic floor exercises for Kegel floor, pelvic floor dysfunction exercise. Little bit about erectile dysfunction. As the age advances, the incidence of ED increases. There is decline in the testosterone. Testosterone supplementation is required sometime, and precautions are like we have to be in young age only start being more physically active, so as the incidence increases. There is male menopause, as in the female menopause, as the andropause is a proven entity now, and it's when there is decreased sex drive, loss of muscle mass, increased sleepiness, generalized weakness, all these factors are there. That means the person is going through the andropause. This is the time that we should look for his testosterone and try and give the testosterone supplementation. So this was a aging male aging study. So in 40 to 70 years of male, there is almost 50% incidence of ED. Out of these 50%, 10% have the complete and the severe one, 15% have mild, and 15 to 30 have the moderate symptoms. So majority of our patients will not open up and tell that they have a ED. We have to ask them, because when we ask, they open up, and sometimes the ED is their predominant factor. It is the cause for their depression. It is the cause for their other problems also. So ED can manifest before other cardiovascular symptoms. So before the heart attack, the penile attack happens. This is very, very important thing, and we should ask, and once we treat this penile attack, their quality of life improves. So there are various medicine and the options of management, like PDE5 inhibitors, injection therapy, vacuum erection devices, and penile prosthesis. PDE5 inhibitor, there are long-term studies that long-term PDE5 inhibitor usage may lead to improvement in the endothelial dysfunction, and there are no systemic risk. So nowadays we are giving low-dose PDE5 inhibitor for our prostate patients also. So there are studies, long-term studies, that they are found to be safe. Sex in some patients is the cause for their heart failure or heart attack. There are few case reports what was mentioned in the literature, but not the PDE5 inhibitors. The vacuum erection devices, they are also helpful, but the satisfaction is not very good, 35 to 50%, because of the messy and the user dependency. Something about urinary tract infections, it's a common problem, and almost 10% of old male and 20% of old female, they have bacteriuria, and all asymptomatic bacteriuria need not to be treated. There are clear-cut indications when we should treat them whenever there is complicated UTI, and why it happens? Because of decrease in the cell-mediated immunity in old age, when there are concurrent comorbidities like diabetes, Parkinsonism, inability to empty the bladder, like because of prostate enlargement, and because of diabetes cystopathy. It's a very, very well-known fact that because of diabetes, long-term diabetes, the detrusor functions, they decreases, and there is diabetic cystopathy. So patient will start holding urine, which is quite significant, which is the cause of UTI. Poor hygiene, the phimosis, very, very important thing. In the elderly, this is the one cause for the infection. And the symptoms, not like in the young men, the UTI in the elderly can be just lethargy, confusion, altered sensorium, and the weakness or new onset incontinence. Urosepsis, if not treated early, may lead to hypothermia and mortality up to the 40% of our patients. So briefly discussing about the treatment in the UTI is like appropriate antibiotics, duration and the correct doses, intermittent catheterization, for female the estrogen topical supplementation, and sometimes the cranberry juice and all these local application can help. So tips to prevent UTIs, like drink good amount of water, empty your bladder often, maintain good hygiene, wear good breathable clothing, and reduce intake of caffeine, alcohol, and spicy foods. That's all I had to deliver today, and thank you very much for your attention. I'll be happy to answer if there are any.
We'll take one comment or a question from the chairperson, sir. We've had a question session in the middle, unfortunately. Yes. Sir, if you would like to conclude.
Yes. Great presentation as usual.
Thank you, sir. Thank you very much.
Now, tell me, in cases of erectile dysfunction, what do you feel, is it a disease, or is it a harbinger of something, as you really mentioned out in the heart?
So erectile dysfunction is basically a syndrome.
Exactly.
It's definitely, there is vascular pathology, there are psychological pathologies, it's multiple factors leading to the ED. So we have to take this thing in totality. What is the age of patient, what is the profile, what are other comorbidities. So ED itself is sometimes, in majority of cases, in fact, as I told, that penile attack happens before the heart attack. If we ask a person who is 40, 45 years that he's not having sexual good erectile function, that means his testosterone is low, he is having metabolic syndrome, And when asked to send this patient to cardiology, there is very high chance that he's going to have one or multiple vessel disease. So we have to treat all these patients with due diligence, with proper medical. And
What Dr. Rana is saying is that no longer is ED just an isolated event. It is a symptom of something going on in the body. And if you get a patient of erectile dysfunction, it is important to find out if he's got diabetes, if he's a coronary artery disease problems, or if he's got hypertension. There are so many diseases which result in erectile dysfunction. So basically, when you get a patient of erectile dysfunction, think, can it be diabetes? Can it be cardiovascular disease? Can it be hypertension or metabolic syndrome? Is that right?
Great, sir. Thank you, sir.
Thank you very much, sir.
Thank you.
So if you may please present to our esteemed speaker. Sir, we would also like to present a green welcome to you.